a really tricky one, and sort of TransActual, we did a big community voice survey at the start of 2021, and we spoke to more than 700 UK-based trans people. And whilst a lot of people had good experiences with healthcare, I am sad to say that trans people reported facing racism, accessing healthcare, ableism. A lot of non-binary people experienced discrimination on the basis of being non-binary, and that's in transition-related care as well as in more general healthcare. And then, of course, in more general healthcare, some trans people experience transphobia, and that does, create barriers to accessing healthcare. And some people told us that they did avoid seeking healthcare. So things that you can do to reduce barriers is, finding ways to signal, non-verbally that your service is trans inclusive and you've thought about trans people's needs. So like I said, it could be making your forms non-binary inclusive. It could be that in your waiting room, you've got literature that's targeted towards trans people. So if you're a sexual health clinic, for example, there's literature available targeted towards trans people, because whilst broadly, it's all roughly the same, actually, it needs framing in a different way. Or if you're a clinic that is deals with prostate cancer, for example, you might make sure that in your waiting room you've got a poster up that shows a trans woman, because trans women, do also need to access prostate cancer screening and could potentially get prostate cancer. So it's little signals like that, making sure that you don't make assumptions. So, and this goes for, admin staff, reception staff as well, knowing that don't make an assumption based on whether someone's got a deep voice or not. That's a sort of common thing that makes people nervous, is making a phone call. So for me, I get nervous that someone might think I'm a woman, and when I'm a man. But for some trans women, they might get mistaken for a man and called sir on the phone, and that sort of adds additional barriers and would prevent them from phoning up in the future. So it's lots of little, quite subtle things, but I'd say, visibility and silent signals, but also, avoid making assumptions. Yeah, so at TransActual, we hear about a really wide range of experiences. Some terrible, some great. So, examples of bad experiences, people whose doctor refused to refer them to a gender identity clinic. We hear lots of reasons why that happens. Sometimes it's because someone has a disability or someone is autistic, so that ableism comes into play. General practice surgeries refusing to change someone's sex or name on the medical records and going against the national guidance. We've heard stories of trans people that have been on hormones for years and they've moved to a different GP, so general practitioner, and they've refused to continue the prescription. It's particularly an issue if people move from overseas into the UK, and I would imagine it's the same in other countries too. Lots of things like that. I've been hearing stories of trans men requesting hysterectomies because of endometriosis or cysts or things that are causing pain.